News, and in an effort to gain public trust, Moderna releasing in-depth documents detailing its COVID vaccine safety trials. The biotech company is one of 3 backed by the U.S. government in late-stage testing.
All right, joining us now, Dr. Purvi Parikh, Clinical Assistant Professor of Infectious Diseases at Immunology at NYU Langone. All right, the question is, I guess, will we be able to have a good enough picture by election time or whatever? We know the pressure is on from the president to get some sort of vaccine out. Basically, the result of this is that it's going to take longer than that, though, to have a real good idea whether these are safe, right?
Right. You know, what Moderna is saying is that the first analysis won't even occur until December, and then there will be subsequent ones in March and May. So that definitely is not a timeline before Election Day. And probably due to supply and demand, by the time everyone gets vaccinated, it may already be 2022 almost.
Right. So another year of this, essentially.
Right.
Potentially, yeah.
Right.
Yeah, and we've been hearing that when, in fact, they are able to disseminate the vaccines, it's really going to be the essential workers and the elderly. So when we think about when, you know, people like us...
The idea of getting back to normal or whatever could be a long way off, yeah.
We are looking at quite a while. Okay.
Right.
Yeah. Doctor, let me ask you about this. There's more evidence, and we were just talking about this before, that COVID is hitting pregnant women particularly hard. Tell us what you know about that.
Right. No, it's concerning because a new study has shown that, you know, women who are COVID positive were more likely to have preterm deliveries. And some of them, about 10, even had miscarriages or stillbirths. And it was even more concerning because I believe a couple of them, 5 of them, were pretty far into their pregnancy. They were past 20 weeks. So that was alarming. And also, many of them didn't even show symptoms. Of course, some were very sick and were in the ICU, and a couple had passed away, but many didn't even know that they had it. And as you know, many hospitals screen everybody that now comes in to deliver or for anything. So that's how they learned of this.
So what would the advice be to women who are currently pregnant listening to this and getting concerned?
Right. So, you know, if you are pregnant, you need to take extra precautions because of those risks, not only for the baby, but for yourself as well, because we know that this occurs, you know, with the flu virus and other illnesses. Pregnant women are at higher risk. So, you know, avoid non-essential activities, keep wearing your mask, social distance. And this is more reason, you know, those vaccine trials need to include pregnant women, which unfortunately currently they do not.
That's
yeah, it's
right.
interesting.
Or
you know,
children.
I mean, when Anna gave birth in late April, we were under the impression that somehow pregnancy might be protective.
Right.
Our whole thoughts around this continue to shift as we get more information. Big time. It's interesting. Dr. Purvi Parikh, we appreciate it. Thank you very much.
Thank you. Thanks.
Nick Gray.